My name is Dr. Jeffrey Thompson. I'm an assistant professor of medicine at the University of Pennsylvania. Full disclosure, I'm a pulmonologist with expertise in biomarker testing in non-small cell lung cancer. And today I'm going to talk to you about HER2 mutated non-small cell lung cancer. So I'm sure all of you may know that the treatment landscape from non-small cell lung cancer has really evolved quite dramatically over the last 2 decades, as Dr. Calvo's picture really so eloquently pointed out. But I think this has been in large part due to understanding of lung cancer genetics. And really over the years, we've been able to increasingly identify these genetic alterations which are oncogenic drivers in non-small cell lung cancer. And this has really enabled the development of therapies that target these specific oncogenic driver mutations. And I really like this schematic from the Lung Cancer Research Foundation that just demonstrates, by decade, the number of therapies that are available for our patients. And you can see in the kind of blue pill cartoon here, the kind of rapid expansion that we're seeing in the number of targeted therapies that are available for our patients. This is just another schematic that was published in Nature Reviews Clinical Oncology last year, just highlighting the number of FDA-approved therapies for non-small cell lung cancer that have occurred just in the last decade. And you can see in the blue boxes represents the targeted therapies that have been approved. And you can see in the early 2000s, these FDA approvals were rather sparse, and that these have really accelerated quite rapidly in the last decade or so, with now multiple different targeted therapies for a number of oncogenic drivers available for our patients. And this pace has really continued over the last several years. And I think targeting these oncogenic driver mutations is really driving a lot of the survival gains that we're seeing in non-small cell lung cancer patients. So I just highlight here that this is a Kaplan-Meier curve showing survival probability here in the y-axis and months in the x-axis. And this blue line represents patients that had a specific oncogenic driver mutation detected that were then treated with the appropriate targeted therapy. And it was identified that those patients had improved overall survival compared to these patients in the orange line who had a specific oncogenic driver mutation detected but did not receive the effective targeted therapy. And so it's not only important to test patients for specific biomarkers and oncogenic driver mutations, but that they receive the appropriate therapies. And unfortunately, we still have some work to do to ensure that our patients are receiving comprehensive biomarker testing for all of the various oncogenic driver mutations for which there are targeted therapies available at diagnosis. This was some data that was presented at last year's ASCO meeting that evaluated over 3,000 patients with non-small cell lung cancer and looked at whether they had guideline recommended comprehensive biomarker testing at diagnosis. And unfortunately, only 37% of these patients received comprehensive biomarker testing prior to receiving a first-line therapy. And so, just as Dr. Calvo mentioned, I empower you to be knowledgeable about appropriate biomarker testing, know your biomarker, and really encourage others to know their own biomarker testing at diagnosis, because this is such a critically important thing to ensure that our patients are receiving the most effective therapies. And as Dr. Calvo mentioned, don't be stuck in the past with an old cell phone. So these are the current biomarker recommendations put forth by the National Comprehensive Care Network. So in non-squamous histologies, current recommendations are that patients receive PD-L1 immunohistochemistry and genetic mutation testing for mutations in EGFR, ALK, ROS1, BRAF, KRAS, MET, NTRK, and RET. And in squamous histologies, patients should have PD-L1 immunohistochemistry, and then they should be considered for broad molecular testing in the similar way that you do testing in non-squamous histologies. And they also highlight emerging biomarkers, which include HER2, mutated non-small cell lung cancer, and MET amplifications. And I'm going to spend the rest of my time really focusing on HER2 mutated non-small cell lung cancer. As highlighted here, there's been very recent data showing efficacy of a number of targeted therapies for HER2 mutated non-small cell lung cancer. And I think it's really become a specific genetic alteration within non-small cell lung cancer that really should be incorporated into routine testing in our clinical practice.